Hi, I'm Mark Levin, Chief of Policy and Innovation at Right on Crime here at the Texas Public Policy Foundation. Thank you for joining us for this program as we look at community corrections in the time of COVID-19. Now, as you may know, probation and parole are a very important part of the criminal justice system, encompassing about 3 times as many people that are incarcerated. And of course, about 40% of the people who are sent to prison are people that are revoked traditionally from probation and parole, although that number seems to have gone down quite a bit in the last several months, which is one thing we'll get into. But it's very critical that we have the most effective systems possible in terms of community supervision so that we can reduce recidivism, we can reintegrate people into the workforce, and we can also save taxpayer dollars. And I'm really delighted that we have 2 of the top leaders, both from a public policy making standpoint and actually leading a probation department, one of the largest in the nations, one of the largest in the nation, joining us today. So let me first introduce Dr. Theresa May, who has over 20 years of experience in criminal justice. She also has a PhD in psychology from SMU University in Dallas, and she was head of the probation department in Dallas, did a terrific job there, and then moved on to Harris County, which is of course Houston, and has attracted national attention by implementing many changes that have led to lower recidivism and provided rehabilitation opportunities, particularly for people with addiction and mental health challenges. I'm also really delighted to be joined by another good friend of mine, Chairman James White. He's chair of the Texas House Corrections Committee and has really been the leader in the Texas House when it comes to smart criminal justice reforms. Chairman White has a distinguished background. He served in the U.S. Army from 1987 to 1990 as part of the Berlin Brigade during the time when the Berlin Wall fell and we won the Cold War. And of course, he's been a public school educator for many years, and he's had received many awards, both from Texas Monthly as well as many conservative organizations, as the top legislator in Texas. And indeed, I believe in 2018 had the highest percentage vote of any lawmaker being reelected. So he's a true champion for Texas and for public safety and second chances. So I'm really glad that we have both Dr. May and Chairman White with us. And before I turn to them, I wanted to just talk a little bit about the backdrop to this discussion, which really is that probation and parole over the last few years, I think there's been a national realization about how important these systems are. And because too many Americans, I think when they think of criminal justice system, they just think of prisons. And I think that the other thing that we've really seen is an emphasis on getting results. So we traditionally would measure somebody's probation term by how many years? 3 years, 5 years, 10 years. And now a lot of people are asking, why don't we measure people's progress and reward results? And so we've seen a lot of states, for example, adopt earned time policies where people can earn their way off of probation. And then I think we've also seen a real greater attention to the important skills that supervision officers bring to the table and how we can train them to make them more effective in that and make sure they have manageable caseloads. This was already going on. And then of course, in March, we had the pandemic start. And that really, I think, forced a lot of supervision agencies to look at things like virtual hearings and virtual check-ins, and also just reevaluate how many people that needed to be supervised for how long. And so I think today you'll find that from Dr. May, you'll hear a lot about some of the practices that have evolved in Harris County. And then, of course, as we look towards the legislative session here in Texas, and I know many of you are in other states, many of those are also like Texas in that there has not been a session since the pandemic started. Texas is among other states that meet every other year. So in January, legislators are going to face a budget shortfall of billions of dollars. One of the positives is the prison population is at its lowest point in more than a decade. 126,950 people, used to be 160,000. So that's something that, of course, could change as the system reopens. But that's one backdrop to it. And also wanting to make sure we continue to reduce crime, which has declined 40% since Texas began its reforms in 2007 of criminal justice. So we really hope this conversation will set the table for that legislative session. So what I'd like to do now is turn to each panelist to give some opening comments, and perhaps I'll start with you, Dr. May, so you could give us an update about some of the things, frankly, you've been doing that were so successful in terms of diversion before the pandemic and how your agency has adapted to that, and what advice you might have for others in your shoes and policymakers based on that.
Okay, well, thank you, Mark. You know, the one thing I think about when we're going into a difficult session is we need to make sure we remember our history. And that includes, you know, Harris County and the entire state. You know, back in 2011, 2010, Harris County was sending about a little over 15,000 people to prison every year. This year, if you don't count parole revocations, we sent about 6,000 people to prison or state jail. I mean, that's a dramatic drop. But I think most of you are familiar with, you know, some of the reforms we did specifically with regard to state jail felonies, which we know have high recidivism rates, get committed at very high rates, and literally, you know, just cycle in and out of the system, which really bogs down the jails and the prisons. And Harris County has made dramatic progress in terms of some innovative strategies with that. We've reduced down from almost 6,000 cases to 2,020 at the end of FY19. And of course, it's lower right now. Revocations are down, but it's not by accident. You know, it's by a lot of really key things that we implemented. And, you know, Mark, I know we can talk more kind of about the changes that we made in Harris County to shift to COVID-19 and address, you know, probationer needs and keep things going. But I can tell you that the technology was awesome. And we were able to pivot to that pretty quickly because of some key reforms we put into place and new technology, you know, right before COVID or the years before.
Well, let me turn to you, Chairman. What have you seen kind of since the pandemic started as far as the criminal justice system in Texas, and kind of where do you will go from here based on that, particularly as it relates to probation?
Yes, thank you so much for having me on with you today, Mark. And we want to definitely thank our great friend, Dr. May, for her great work in Harris County and how it has impacted our approach to probation and criminal justice in general. And I have several great probation chiefs in my district. My district includes 5 counties, which we're proud to represent: Polk, Tyler, Jasper, Newton, and Hardin counties. And this team of probation chiefs, I believe, are also on the cutting edge with Dr. May. And what's unique about these probation chiefs is that they're they're particularly in a rural area. So we champion the work of probation. We value their work. They are an integral approach to criminal justice, especially as it relates to public safety and rehabilitation of those that are adversely, that come on the adverse side of the law. Now, as you stated, right now, we're a little over 126,000 in total prison population. I think a lot of that is due to our ability to not take jail commitments during this pandemic response. Slowly, the TDCJ, the Texas Department of Criminal Justice, is starting that again, okay? Taking those county jail intakes. So I think that's part of it. And also part of it is the work of our parole folks and evaluating folks, getting them into rehabilitation services while they are incarcerated in TDCJ, and safely and responsibly releasing them back into their communities to continue their rehabilitation and their incarceration sentence, their sentence of conviction in free society. But when we look at probation overall, Mark, we're seeing about maybe 151,000 that are on probation due to felony offenses, and roughly about 69, 70,000 for misdemeanors. So that gets us at about 220,000. So that's twice as many are on probation than in the lockup. So not only is that a significant saving, but as Dr. May has proven in Harris County, it is an effective approach because they have a very data-driven approach in determining probation candidates, so to speak, and getting them rehabilitated and making sure that they do not recidivate at a high rate. Now, before the pandemic, felony and misdemeanor placements were about 9,700 when you look back to February 2020. Because of the grinding halt in our courtrooms due to the pandemic, statewide, that's about 17 to 1,800. So that is a fraction of what we would normally do. So that has forced or encouraged probation to do some things that are cutting edge, that are pragmatic, that make common sense. Because our probationers are probably out of work, like too many of our Texans right now, they don't have the probationary fees to pay that were the terms of their probationary sentence. So from a pragmatic and common sense way, and I want to thank our probation community, our probation leaders throughout Texas, they have not sanctioned or punished these probationers, and really they never do that, for their inability to not pay the probation fees. So they have continued the terms of supervision using technologies like we're using today. I believe we're using Zoom. I believe our probation offices are using Facebook Live, telephonic supervision of these folks. And we're finding out, and they're doing the data, they're finding out that they can still maintain a sufficient level of supervision with many of these probationers and still ensure that our community is safe. So I want to thank them for that. Going forward, I think the challenge is because many of our probation departments statewide, probationary fees are a significant portion of their operations. So if we want to continue to have this tool on the table, and we will have it on the table, the state of Texas, that's the legislature, will need to come up with a way fiscally to backstop the precipitous drop in these fees and their revenue so they can continue the work. So I see that as a challenge, but I see that as a welcoming challenge because we're seeing without these probationary fees, many of our probation departments can continue their criminal justice charge, but we just got to make sure that they're funded appropriately so they can do all the work that we want them to do.
Yeah, no, and I'll turn it over to Teresa because I know she wants to talk. That's been something she's worked on for so long. And just so our audience knows, in Texas, there was a law passed several sessions ago that says you can't be revoked from probation solely for not paying your fees. But even since that law, it was one of the reasons that was indicated in a majority of the motions to revoke, in addition to things like missing appointments or not passing a drug test and other things like that. So, but we've also heard the Rabin Institute, which some of our audience may be familiar with. They did a really interesting qualitative study, and they interviewed a number of both, probation officers and chiefs in Texas and so forth. And, some of the anecdotes that were in that report dealt with, people on probation not showing up for their appointment because they didn't have their fee. And which is, of course, the worst thing they can do, because I already told you can't be solely for that. But it just illustrates. And then they also, what was in that report was probation officers saying that like it distorted work because they were spending so much effort trying to collect fees versus doing motivational interviewing, cognitive behavioral therapy, doing the things to actually change behavior. So Teresa, I wonder if you could pick up on that about, really, do we need to look at the probation funding formula? we fund primarily based on how many people are on probation, which isn't necessarily what we don't necessarily want people to be on longer than necessary.
It really is an antiquated funding system that we're using now, and it hasn't changed in over 40 years. You know, back when probation started, our main job, probation's what, was just to monitor conditions and report out to the court if something was violated. And, you know, we all know that that's not a very effective way to change behavior, to get good recidivism results, to reduce prison admissions and reduce crime even. And it's certainly not cost effective. Unfortunately, you know, the amount of basic supervision that we get from the state, the last time I looked, it was right now, it's around $1, I think 25 or something. It hasn't really, it's only changed maybe 20 cents since 40 years ago per client. So just counting the number of individuals on supervision, it's based on an outdated model of just counting widgets. You know, that's what probation used to do. We used to just count widgets. We know that didn't work. We know it doesn't make sense. So absolutely, that needs to be looked at. And we know that probation departments were really struggling before we went into COVID. In fact, this legislative session, you know, we were having conversations with Brian Collier because we really are in a hole in terms of our basic operating funds. Then when you add on top of that, the fact that probation is so dependent on supervision fees. You know, for Harris County, and I'm a larger department, you know, supervision fees were 55% of my basic operating budget. That's how I pay officers. And those collections or the fees that are coming in are down at least 20-25%. We already had not the greatest collection rate, but you know, it certainly is an unstable way to fund departments. And then for some of our smaller departments, like in Chairman White's area, you know, there are departments that are, you know, 60% of their or 70% of their basic operating fund is solely fees, which really is not where we're headed. You know, Mark, I don't know all the solutions, but I certainly think we need some kind of backup, some way to address this where fees are not one of our primary sources of funding. And that's going to have to be looked at somehow. In fact, right now, you know, there are some departments that have already laid people off. There's some that have had to do furloughs. And honestly, you know, if this persists, I mean, Harris County may end up certainly in the same boat. We have had to lay off a few people just to try and adjust, but it's not working and the numbers don't work out. You know, some people will argue, well, you know, if your cases are going down, the number of cases, then there's not as much work. Why do you need more staff? And the reality is probation officers, as you said earlier, you need skilled people. They're not doing just monitoring. Certainly, you know, we do monitor conditions, but more importantly, we do assessments that identify what's really keeping a person in trouble and in the cycle of crime. And probation has gotten very good across the state, not just in Harris County, at targeting specific need areas that drive crime. And the research is overwhelming out there that when you address those fundamental needs that increase recidivism and drive what's happening to a person, you can have an impact. You can decrease recidivism and keep people out of the system for good. And that's been a big focus. So the funding is a huge problem. And the other thing from a department that's been through a major hurricane, you know, in Harvey most recently, you know, I have seen the impact on the courts and the system where things were shut down, you know, for 2 or 3 weeks, where we really couldn't operate. And even then you could see an impact and a backlog of you know, people on bond and cases not moving. And and a decrease in placements, it takes a while. You can't unwind that very quickly. So one concern I have in looking at the numbers, the placements are down, but what I also know as a member of the coordinating council and a key stakeholder in Harris County, we have extraordinary numbers of people on bond. And at this point, it's not a good thing, you know, to have many, many people out on bond, and you can't have many, many people pending in jail either. So it's a very difficult situation. And we know as the courts start back up, probation has to be able to do their job. And our concern is, you know, as we're losing staff, because we don't have the money. If that continues, you know, for a long period of time, where probation departments are hit very hard, we're going to be in a very difficult position to address the individuals coming into the system that are just waiting right now out on bond. And, you know, there are a lot of folks that really do need help. These are not all just, you know, low-level cases that, you know, are going to end up getting dismissed or going away. I mean, there's everything out there.
So Chairman White, I was going to ask you as far as some of the things the legislature's considered in previous sessions dealing with the funding formula, for example, away from how many people are on probation at any given time in a department, which could encourage keeping people on longer than needed, to, of course, in some options or in juvenile probation, it's more based on intakes, how many admissions there are to probation. So then it's not affected by how long somebody's on. And then, you know, of course, there's also been suggestions about looking at, you know, taking into account the risk needs level of the caseload, because some people are more expensive to supervise than others. But what direction do you think we should go in terms of, you know, calculating how much each department, you know, gets from the state?
Yes, thank you so much for that, Mark. And let me say, I would, as far as a probation chief, him or herself in their department, I'm hesitant to say that they are promoting or championing anybody to stay on for a long period of time. Okay. We have a great state. We have a state that was created, founded, and developed on this idea of a lot of local discretion. You know, we have a big state, and it's difficult. It was difficult in the 1800s, and I still think it's difficult in the 21st century for Austin to have you know, too much control. I mean, it's just not possible. The geography, the diversity of the state. So a lot of these decisions about probation, who gets on probation, how long they're on probation, resides with elected judges and elected district attorneys. Obviously, we have a constitutional amendment, a state constitutional amendment, where victims are also allowed to weigh in at some level and state their opinion. So I think there are a whole lot of other dynamics. And also you have the probation chief and his or her crew or team. They're doing data-driven analysis from individual to individual. And so the terms of probation, the rehabilitation, the conditions, we're thinking are driven in some way by this data-driven prospect. To your question, I think first, just getting probation up to a point where, you know, their eyes, their nose, their mouths are above the water. And Mark, you know, for a little bit last week, a lot of the right on crime advocates here in Texas, we had a Zoom call with you. I think you guys had a lot of great ideas. I really think deeply, in a deep way, the legislature is going to really have to just look at the entire budget of Texas. Mr. Levin, I think about the work that Dr. May has done on pretrial diversion, and we still have several, what do we call these things? State jails.
Right.
Okay, we still have several state jails. And at the same time, we have thousands and thousands of Texans that have not been convicted of anything, waiting for a forensic bed so we can get them to a certain level of competency to stand trial. We don't have any child psychiatric beds. So it seems to me that a lot of our approaches in the state budget do not align to the reality of what's going on in the state today. So let me just go ahead and throw this boulder in the middle of the pond. I really think what we need to do is, from a budget standpoint, because that's where it all starts, we need to start with zero out TDCJ. We need to zero out DFPS. We need to zero out TEA, public education, zero out HHSC, and then we need to rebuild our budget based on the needs and the data-driven analysis that we know now. We need to make sure that we're front-loading in the smart approaches at the public education standpoint, because we know education is a great multiplier in making sure that not very many people end up in prison. We need to make sure that we're front-loading on behavioral and mental health. We need to make sure that we're front-loading on DFPS and in particular CPS. And we need to make sure that we're appropriating to TDCJ what they need to keep people locked up that are in danger to our property and our life. And we just need to reorder and reprioritize our budget. A lot of the things that we talked about last week with the Right on Crime Committee, they were great bills to talk about, but they're just episodic. We need a reordering of our budget in order to respond to the challenges that we see now post-COVID.
Yeah, and Teresa, I think kind of the theme of that is that sometimes if you nip a problem in the bud quickly, you can make a difference, and that applies to people's lives. And this does lead me to ask you about the pretrial diversion program that you started several years ago, because that was by reaching people very soon after they arrived in county jail. They didn't plead a time served. They didn't accumulate a bunch of time. So they had more of an incentive to take the diversion, which didn't include a conviction. And so you effectively front loaded the resources and gave people an early opportunity. And maybe you could share some of the results from that.
Sure. I mean, one of the, and we've talked, this has been nationally recognized at this point, but Harris County did, at one point we were the largest drivers of state jail felonies, not surprising, we're the biggest county. And that's something we wanted to take on. Not only is it, not a good thing to continue to send people to state jail, it's also not a good thing to send people to state jail when we know the recidivism rates are extremely high. For the higher risk individuals, it's 70%. And I think LBB has reported like an average of around 60% recidivism rate. When you get down to including high risk individuals with lots of history, it's 20-something% for probation. And we were able to do things, like you said, with this particular program, to make sure that we capitalize on the fact that probation really can intervene. Chairman White mentioned mental health and substance abuse, and those are things that probation departments partner with their local LMHAs. We work very hand in hand with the community and provide those services. But everything, as you know, starts with an assessment, Mark. And one of the things that we did with the particular state jail felony population you're talking about is, first, if it's at all possible, make sure they're out on a PR bond if they don't make a surety bond. We don't let individuals sit in jail, but you can't let them sit out on bond indefinitely either, because when people end up in the criminal justice system that are more moderate to high risk, which are the individuals we're concerned about, they have a lot of needs. And when I say high risk, that doesn't mean high risk for violence. In this population, we're talking about high risk for repeatedly getting in trouble, usually, with thefts or drug addiction related problems. So we stopped and made a deliberate attempt by consolidating all of the PCS cases and prostitution fourth and a few other cases into one docket away from 22 dockets so that we could ensure that these individuals are getting out of jail, that we're doing a quick assessment, that they're getting, and our district attorneys work with us where we can offer a pretrial diversion very quickly. And she's done a great job, DA Ogg, in working with us on this as well, and being willing to, make sure individuals without big histories are able to get a pretrial diversion for drug cases and prostitution fourth and a few others. And what that allows us to do is we do the assessment just like we would for any deferred case. And we make sure we're getting people's needs and it's met early. But if you don't move quick and they're sitting out there, you do lose people. So the key, exactly, Mark, is you have to be able to act very quickly. And it really works when you engage the entire stakeholder group, in a county. But probation's, been really, really central in that. And we've formed great partnerships. We make it happen. We get the assessments done, and we get people in treatment as quickly as possible. And I can tell you, the last thing we can afford in Texas, whether it's pretrial diversion or even deferred, is not being able to get assessments and treatment services and supervision services in place very quickly for people that are justice involved and have more issues going on. You have to address those needs. And one thing I really want to mention that I think is very important is, there's a lot of research out there. Jennifer Skeem out of Berkeley, she's at Berkeley now, did a study a few years ago. And what her study showed is for individuals that are justice involved, that have higher needs, the most effective systems have a probation officer specially trained to work with individuals with mental illness, working hand in hand with case managers from the local LMHA. And at the same time, you're getting treatment. Both people know what's going on. And one of the things I really want to make sure people understand as we go in, these partnerships are vital. And it's really important that a person have both the supervision and the case management and the treatment together, because together we make it work. And if you ask many of our LMHA partners, they'll tell you, people are more likely to go get their medication. They're more likely to do what they need to do when they're working hand in hand with a probation officer and a case manager, as well as the treatment. Those are key. One other thing I'll really mention very quickly too, on the state jail felony program, some of the other key things on the pretrial diversion we wanted to do is, it's a 1-year pretrial diversion. The contract is 1 year. And we deliberately did that because we've heard a lot of feedback through the years. Probation can be overwhelming. It doesn't make a lot of sense to pile a ton of things on top of a person. So the assessment's critical because our goal is to get the person exactly what they need as quickly as possible. That allows us to do that with the pretrial diversions, and they're not looking at forever. Really, honestly, how long they're on depends on the person. There's a number of people that do well that are off in 6 months. The DA is willing to let them off if they've done everything. There are other individuals, though, that have heroin addictions and mental health symptoms, and they're involved with other individuals involved in crime. And they really need that critical partnership that I just mentioned earlier between the LMHAs and probation to get their life together. And, it's been very effective. I mentioned to you early in this broadcast, we went from almost 6,000 cases going to state jail a year, and it's down to 2. It's going to probably be a little bit under 2. And that was in place before COVID. So, I just want to make sure people understand this is not it's a pattern that's held. It's been very effective. The recidivism rates are great, significantly lower, very few people coming back. We don't revocation is not something we do automatically. As well, if people struggle in this, we intervene. And what we look at is what's going on, what isn't working. Do they need a higher level of treatment? Which sometimes that's the case. They need treatment in one of our community corrections programs that wrap around a person and get them stable and work on employment and family. And if we don't have the resources to continue to operate those programs and do the supervision we need, you're going to feel it. I think, there's been a few state jails that have been closed down. I mean, Chairman, you'll know better than me, since we started this program, in 2016. Harris County, I mean, it's not small numbers that it's dropped. So, I think that's really important.
Yeah, you have residential beds in Harris County, including for people with co-occurring disorders.
We do. We do. And, the other thing a lot of people don't realize, and Chairman probably knows this, there's a co-occurring disorder program. There's 3 of these programs around the state. Harris County has one, Dallas and Bear. And then, we, to the extent possible, we take in, clients from around the state. Some of the folks from Chairman White's area send people to Harris County. And we never have enough of those beds. And the population that goes in there, these are individuals, even if you talk to the head of our LMHA, he will tell you there is nowhere else. There's nowhere in the community that's really equipped to help this specific population. And the beds have been extremely effective. And you've seen some of the fact sheets, Mark, through the years, significant reductions in recidivism, as well as rehospitalizations. And again, those programs work off a model where the LMHA and the CSCD partner together, along with some other community folks. And it really does help these individuals in the long run. And
just so people know, the alternative for the state jail population, state jail felonies like possession of less than a gram of drugs, is you go to state jail for 6 months, perhaps on average, and there's very little there. So you're not really incapacitating anyone for a significant period of time, but they're losing their connections to family and employment.
That's right.
Yeah.
That's right. And family's very much a part of it. And honestly, these programs serve everyone, right? There are state jail felonies in the programs, but there are also individuals with 3rd degrees, some 2nd degrees that need help. The assessments told us what's going on. We need to intervene and get people in a good place where, their needs are met, they're employed, they're restored, and we can reduce recidivism. And, I am a data person. You've mentioned it several times, and there's just overwhelming evidence that we can do that very effectively. So I think there are solutions, and, Chairman White is correct. I mean, we really have to look at what really does work. What does the data tell us, and what are the needs? And, obviously this isn't a session where we're going to be able to, just kind of, guess at things. We know what works. And we know that, when judges have good sentencing alternatives where a person's getting treatment and intervention, that they're going to use it. We also know from history, if the judges don't have those alternatives, we're going to be building prisons again. So, community supervision and those key support entities, we have to be able to provide these services to save the state money. And, it's substantially more economical to put this person in treatment and get them supervision than it is to, send individuals to prison, cycling in and out. And it's also safer, better for the community.
Yeah, no, and it's very interesting.
Yes, and so Mark, I really hope that the Right on Crime policy folks and everyone else in this space brings us a more deeper and broadly encompassing big idea. And I understand if you're doing criminal justice policy, you don't really want to, say anything about TEA or HHSC, but we need a bigger idea. I don't know. Obviously, with COVID-19 and some of the other events that have occurred this year, we're definitely coming at the end of an era of something, and
Right.
we're about to go into an era of new something, whatever that is. And we've got people in academia to figure that out over the next few decades. But saying that, I think we get too wrapped around, I have one person bring me a bill about, technical violations on parole. I'll have another person that'll bring me a bill about, technical violations on probation. So we have all these pieces of individual legislation. They're probably very well intentioned, very well thought of, and have a role. But if you don't have the budget prioritized in the right manner, that's how you get picked off in the legislative session.
Right.
People can pick you apart. We need a big idea from the thought leaders like yourself, Mark. We need a big idea that starts with hub ed, education in general, goes to health and human services with our response. I mean, think about how ignorant this is. We have thousands and thousands and thousands of people warehousing in a county jail, not convicted of anything. And we talk about bail reform and all of that, not convicted of anything, waiting for a forensic bed because we only have 303 forensic beds. And we probably have several state jails barely occupied because of the great work of Theresa May and her colleagues. We don't have any child psychiatric beds of note. Okay. Our budget is not prioritized to fight and defeat the challenges that we have today. We have a 1970s, 1980s budget. It's probably good back in the day. Okay. But it's not meeting and it's not even responding to the great data success of the Theresa Mays of the world. So that's what we need from the right on crime, all the great think tanks, conservative, liberal, in between, or nonpartisan or whatever, is the big idea. And the big idea starts with the Texas budget, that $250 billion budget. It starts with that and reordering the priorities so we can address the priorities that our society is facing here in Texas.
I couldn't agree more, Chairman White.
And the things that raises is something I know you're very interested in is data. And I mean, part of what you're getting at kind of requires looking even at the longitudinal impact of somebody's life and what that translates into in terms of a budget in our economy in the future. Because, there's research showing if a young adult or a juvenile, if they go on to a lifetime of crime after committing an offense at 15 or something, the cost to society, young victims, is over $3 million. And so it's really important. Yeah. So, I think we do need to think a lot about that. And I think, obviously we can look at, kids that have been exposed to violence and what we can do to intervene, early on. So that's a predictor.
Yes. And Mark, if I could weigh in a little bit more here. So usually my great conservative thought leaders on the budget side, the economic side, they will evaluate my fiscal conservatism on austerity, or however you want to say it, on, okay, last session you spent this amount. If you spend under this amount this session, you're on your way to a conservative budget. And there may be some theory, there may be some reasonable rationality behind that. But again, when I just look at the work that Theresa May and her colleagues have done, and the work that a lot of our juvenile probation chiefs have done, and we have not doubled down on those expenditures and those responses, I have to also ask myself, is it really a conservative budget? Again, state jail commits are down significantly. You write about it almost every week. Crime is down significantly. So why are we paying for prison buildings that by nature, just having them running because they're so old, they're probably more expensive to keep running? That doesn't sound like a very conservative budget to me. Okay. So even though at the end of the day, I may get a check for voting for a conservative budget because I didn't spend this versus that, the budget, the way it's prioritized and set up and what we're doing within the budget is not conservative and not common sense.
Yeah, property and drug, and the counties, if you want to take the funds that are currently being spent at the state level, you can take 2/3 funds and spend them at your county level.
Absolutely. Absolutely. So it's all of that. So if we've got an opioid substance abuse explosion, if we've got forensic commits waiting for a bed to get them up to speed so they can go to trial. If we have a mental health, again, we have to ask ourselves, several state jail facilities, probably not at full capacity. Now, I think we're doing some other things with them as far as putting people in them that need, air conditioning or whatnot. But really, we don't have the mental health bed facilities. Okay. Some of this stuff, if it wasn't me involved, it would be a comedy, right? But no, it's sad and it's ignorant. It's not data driven, and it's frankly just stupid. So hopefully, the Right on Crime, the Texas Public Policy Foundation, and all these other folks will come to us with the big idea and say, this is the time, because we know how the budget and the revenues are kind of looking right now due to COVID. This is the time to say, we're going to zero, especially these expenditures. We're going to take them down to zero, and we're going to because that's where most of the budget is actually. And we're going to rebuild this budget on a data-driven, and you've got the data, Mark, to do this, on a data-driven methodology. And then what you'll find out, all those other bills that y'all talk about, Mark, they start to fit in where they fit in, because you want to shorten probation period times for what? For what reason? You want to go back and look at the sentencing of felons that were convicted of violent crimes when they were 17 or 18 for what? So if you prioritize your budget, then all of those bills fit into place.
Right.
You want to expand pre-K for what? Okay, so you won't have to be paying for these people in the juvenile system, in the criminal justice system, and all these other systems. So all of these things start to fit into place when you get your budget right. So our budget is not prioritized to achieve the aims that the Right on Crime,
Right.
the TPPF, and Dr. May wants to achieve.
Yeah, Chairman White, you hit the nail on the head. I mean, we really do. Probation departments, the other important resources have to be made whole. And,
Right.
One of the other things we did in Harris County over the past couple of years is really integrate a partnership we have with Houston Community College, Texas Workforce Solutions, and a couple of other folks to not only get people the treatment they need, but also to get them on either a certification in a trade in in-demand areas like scaffolding, welding, forklift, logistics. We had tons of our probationers that completed logistics classes with professors that work in the field and had guaranteed job interviews when they get out. And I'm not unique. My colleagues are doing the same thing. But these kinds of things are not even really being thought about right now. Yeah. Probation still being looked at as numbers. We're counting widgets, not what's really happening and impact and savings. No one's looking at the savings. And I think, both you and the chairman pointed that out, and we need to do that. You want to reinvest in what's working and where you get the biggest bang for the buck. And I think we have forgotten about that. The other thing, if you look at Texas, we have done a lot of good things. Our early release numbers are very good. Many people get off deferred early. People don't look at that anymore. We substantially increased that, and we've kind of taken it for granted, that we did that. But I know I do it. I know my colleagues do it. When I look at the report to the governor's office and the LBB that TDCJ prepares, CJAD, we're continuing to do those things that we know work. And more importantly, Texas probation system, the legislature mandated it. We use best practice, the risk needs responsivity model. We do the assessments, we do the interventions, but if we're not made whole, and we really were struggling even before COVID hit, that's not going to be there. Honestly, I'm not going to be able to keep up. There's no way, nor are my colleagues. We've got to pay attention. And, the fact that we only have 3 of those co-occurring disorder programs in the state where the LMHA and probation partner, that's insane. And, Chairman White, you've mentioned the forensic wait time several times. When I looked at the data, the people that go into those programs, the overwhelming majority of them have been through competency restoration. And we do a great job. We're able to get them stabilized, get these individuals the help they need in partnership with our LMHA, and reduce the hospitalizations. So not only we do better with their mental health needs, we're reducing the criminal, repeated criminal behavior. It works. Why aren't we looking at that? Yes. The data are there. I think those are things we need to look at. We've talked about, why are we keeping state jails open? We really need to make sure that these strong treatment programs, the community corrections programs that are around the state, and the concept that we work off of is those are strategically located so that they're in areas where all probation departments, including the rural areas like Chairman White, they don't have anything, can send individuals, get the treatment. We work together as partners, and all the CSCDs do. But we have to have enough. We have to have enough. I have wait lists. I still, that, Mark and Chairman. I have so many people in need of those services. The judges are willing to do it. But when you have a wait of 200 or 300 people trying to get into a bed because there's such a demand and everyone struggles with this. That's yes. Crazy. And we're costing more money in the jail. A lot of individuals when the wait list is long, they're going to end up playing out to time. Why are we doing that?
Right. And so Mark, knowing that I have a military background, right? I look at the probation as they're like your special forces A team. They have highly trained professionals in these probation offices, and they're embedded in your local communities. Okay. And so now they can, we say a special forces A team, a real Green Beret or SEAL team, they can fight, they can deal with stuff, they can do that. So your probation department, yeah, they have the options of sending people downstream in the TDCJ. They can get tougher. But the point is, as we would tell a special forces A team, you're highly trained to do tougher things, but we hope because of your training, we never have to get there. So we're going to give you the training, we're going to give you the resources, and you're going to be we're going to embed you into these communities, and we're going to expect you to take care of it. So we got to look at it that way, and we got to give these folks the resources. And we talk about wraparound resources for the probationer. I think we need to talk about wraparound resources for the probation department, because
Yes.
if they don't have the relationship with the Workforce Commission, if they don't have the resources and the relationship with their LMHA, the local mental health authority and behavioral health authority, if they don't have those relationships and those resources, we're not equipping them. So again, I have to keep saying this. Right now, our budget is stupid and ignorant. It's not following any of the data that we know that works well in education, that works well in DFPS, that works well in juvenile justice, or works well in what is this, TDCJ or probation. We have a budget, and actually we're paying for what we want. Apparently, the budget says we want to pay for a lot of buildings that are it costs too much to keep them going. We want to pay for a lot of people sitting around waiting for mental health services. So we're paying for what we want, and we're getting bad outcomes. So we could probably reorder our budget and probably wouldn't even need any more money. Okay, but our budget is ignorant and stupid right now.
Yeah, no, it's a great point. And you often think about, and you've said earlier, of course, we need prisons to incapacitate people that are very dangerous, but a building has never changed anybody's criminal thinking patterns, but a person can actually do that. And that's, teacher quality. That's the number one correlation to learning. Well, probation officer can have that, whether it's facial interviewing, cognitive behavioral therapy, they can have that same, getting people into a career, as you said. And these are things, dividends more than a 2-year budget cycle, 5-10 years. And Chairman, thank you for kind of thinking about the future of Texas in a long-term holistic way. So we are up on our time here. If either of you want to offer any closing remarks, but we have gone about an hour, so we'll probably wrap it up unless either of you want to offer some final thoughts here.
I can really quickly, and then maybe Chairman can cap it off.
Sure.
But first of all, we cannot forget history. If there are options which probation can provide in terms of treatment and supervision are not available, judges are going to have no choice. People are going to go to prison and state jail. Let's be smart about the funding. We have to rethink probation funding, and at the very least, make probation departments whole, because we may not be able to solve that problem so that we can function. There are some benefits that have happened with the pandemic. Probation departments need the ability to see people virtually and not get, penalized for it. The state had to do a waiver for us to be able to see people face-to-face virtually. And I won't get into it right now because I think that's a better time a little later, but it's been very effective. We're doing treatment groups, we're doing classes, we're doing individual sessions, we're doing reporting virtually, and we still do the other business that we need to face-to-face. So those are all critical. Chairman?
Yes, thank you so much, Mark. And I love listening to you, Chief May. And again, I think we really need, and that's going to be my request of Chairman on the House side, Chairman Giovanni Caprilong, is we've got to reorder our budget to tackle the issues that are in Texas in 2020, not in 1820 or 1920, in 2020. And so, Mark, I love you. You're a strong thought leader. I think you're one of the top 50 in the country, according to Politico. and we need our other friends at the TPPF. They can't just grade us on, well, you didn't spend this amount this time versus that time. You got a conservative budget. I need our great minds over at TPPF, Texas Public Policy Foundation, Vince Ginn and his team. How do we reorder this budget from public ed over in Article 3 to what we're doing in Article 2 to Article 5? And we just can't get into this thing about, well, that's TEA and I'm over here in probation. So I don't really want to get into their business. No, it's all of our business. Okay. It's definitely all of our pocketbooks. So thank you so much for having this forum. And we're looking forward to a very aggressive legislative session, regardless of COVID-19.
Yeah, no, well, thank you, Chairman. And I can tell you, a lot of my colleagues are working on things. As you know, you referenced DFPS. We're doing a lot in child welfare. So how do we, support a single parent household so that there isn't an issue of neglect? We don't remove children unnecessarily, but instead strengthen families. So there's so much overlap on kids on child welfare system, also in the juvenile justice system. A parent could be on probation. So there's we need to look at these households where you might have more than one system touching them. And that would also help us in how we could deliver services most efficiently. So there've been so many great ideas, and I'm just so indebted to both of you for your leadership and your work on community corrections. And I think as we see that as a broader, is kind of within the broader framework of the criminal justice system, and indeed all of our government expenditures, and the prosperity of our economy, which basically comes down to human capital, which is what we've really been talking about in all of these areas, how to bolster the capacity of Texans to be successful and productive and safe. So with that, let me thank everyone for tuning in. Again, I'm Mark Levin with Right on Crime, and I hope you join us for another program. And check out our websites, texaspolicy.com and rightoncrime.com. Thanks again. Bye-bye.
Thank you.
Thank you.